Hi everyone, welcome back. I'm Alex. I'm going to be your moderator for the next hour or so. I'm a long COVID patient since March 2020, and I'm also co-founder of the UK arm of Not Recovered, which is Not Recovered UK. We've been campaigning for research and funding into long COVID and ME/CFS by using billboards and political protests. So during this section, there'll be two speakers who are patients living with long COVID and a community keynote video submission at the end. So I'm now excited to announce our first speaker to this section, Dr. Abigail Koppes. I really hope I pronounced that correctly. Dr. Koppes is an associate professor of engineering in Boston, where our group studies nervous system and gut disorders. She'll be talking to us about navigating academia with long COVID. There'll be a 20-minute presentation and then a 5-minute Q&A. As before, the most upvoted questions we put forward to the speaker. So welcome, and over to you, Dr. Koppes.
Thank you so much for that nice introduction, Alex. You did pronounce my name correctly. And thank you so much to the organizers for this. I'm so glad to see the community get together, and I'm honored to be the first patient speaker for the conference today. So today I'll be talking about going through my personal background as well as my progression of long COVID, a little bit about how I've navigated that while working full time, and also just some advice that I have from what's helped me a little bit. So who am I? My name's Abby Koppes, as mentioned. I have a PhD in biomedical engineering from Rensselaer Polytechnic Institute. I'm 39 years old. I live in Boston, Massachusetts. I'm a tenured professor in chemical engineering at an R1 institute. And what that means is that our institute has a high level of research activity, and that also means a high level of expectations for our job. I've also been married 13 and a half years to my high school sweetheart. We started dating in 2001, so he's really been a rock for me through this. I'm also a sister, daughter, aunt, niece, friend, dog mom, and all sorts of other things, as I'm sure a lot of you are as well. Here's just some pictures of me sort of from my life. So who was I sort of in my before time, before COVID? I was an athlete. I played college sports all through college, softball, soccer, and downhill ski racing. I was a 2-time marathon runner and training for a half marathon when I caught COVID for the first time. I also cross-country mountain bike, hike or yoga, Pilates, basically any sort of outdoor activity or sports activity that you could name, I was interested in doing it. I also really enjoy going to concerts, music festivals. I do arts and crafts. I love gardening, being outside again. Cooking is one of my favorite pastimes, hosting friends over for dinner, reading, travel, and also having an active social life. For my job, I teach or work and do research about 10 hours per day before. That would kind of change anywhere from 8 to 14, depending on what I was doing. I would go to conferences, travel, teach. My teaching was usually 1 class per semester for graduate or undergraduate students. I'd be managing researchers, writing, and all sorts of other activities like meetings. And I'm really lucky that I love my job. Again, also I have local family, my sister, my mom, my husband's family is all living around us, which is really lucky. So for my research, what my lab works on, as mentioned by Alex, is really studying how we can help people with nervous system disorders. So my lab is located at Northeastern University in Boston. We use a number of different tools from engineering, biology, and manufacturing to understand and control cell behavior. I also teach a number of classes in engineering, ranging from ethics to conservation principles, which is basically fluid movement and the energy that goes into that, as well as maths and teaching a lot of freshmen, which is really fun. And I also teach graduate students in a professional development course. I currently have a group that has 5 PhD students, 4 undergraduates, and 2 high school students. I also have funding that I'm responsible for from the National Institute of Health, NASA, and the National Science Foundation for the research that we're doing. So this is what supports our work as a contract base. So going through my COVID progression, basically, I got COVID in the first wave in March of 2020, the very last week. My case of COVID was extremely mild. I just lost my smell and taste. And as we all know, there was no PCR tests available at that time in the area that I was in. Around April to June, right after that, so starting the very first week of April, I would wake up short of breath, kind of my heart pounding, feeling anxious, and I really gaslit myself looking back at that, thinking, oh, I must just be stressed about the pandemic, right? July comes around, my fatigue was mild. I blame the stress again. Oh, my job is really hard. I'm going through tenure right now, which is a stressful process. So it must be from that. Starting in June of 2021, so a little while later, after feeling fatigued for a number of months, I was still working out, still doing all these things, using a lot of energy. And I had my first migraine attack where I'd never had one before. Come July, I had my second migraine attack. The mid-July, my third, end of July, my fourth. So they started really increasing in frequency. And by late August, I was having migraine and extreme fatigue every single day, loud tinnitus in both ears. I was feeling nauseous. I had visual snow. My vision itself was blurry, and every day I would wake up and it would be a little bit worse. And my PCP ordered MRI and it all was normal. So I started normal migraine treatments. In September of 2021, I started another migraine prophylactic because I wasn't responding. I was advised at that time to keep exercising because it was supposedly going to help my migraine. I was still going to work daily in September, which was tricky, but I was pushing through. So I remember specifically I was sitting introducing a speaker like at a different conference, and I was trying to read the paper with their information on it, and it started seeing double and I had to sit down. So that was the first day that I went home, and I didn't return to work in person for a number of months. I went to the ER on September 24th, 2021, because I sat up on my couch. My heart started racing over 200 beats per minute. I was short of breath and faint. The ER told me it was anxiety. They gave me a Xanax, sent me home with some fluids. I said, okay, maybe I'm just stressed. You're still gaslighting yourself, right? Come October, I was feeling hungover. I felt like I was poisoned. I described people. I feel like I'm hungover with the worst food poisoning of my life every day. It was very difficult for me to get out of bed to even get to the bathroom. Photosensitivity. I, at this point, moved fully to asynchronous teaching. So I would make my course materials sort of in between all of the, things that were going on with my body, right? So I would, on a good moment, try to put my work together. I was having all my meetings, on Zoom without the screen on because of the photosensitivity. And I then started my third migraine prophylactic. And all of a sudden in October, it felt like my entire body was itchy, covered in hot oil, and as if someone had actually lit that oil on fire. I wasn't sure how someone could really be alive and feel like that, right, at this time. I then started having an axe like stabbing and electrocuting feeling in the back of my head. So my PCP, then said, okay, let's get you to a neurologist. So I go to a neurologist and they started me on a calcitonin gene-related peptide inhibitor, which is a newer class of migraine treatment. I was still having migraines at least 5 days I said per month, but 5 days per week. And my neurologist at the time suspected small fiber neuropathy. So I still felt like I was sort of walking through mud, or, my body felt like lead. And at this point, I still also was having photosensitivity, and I couldn't read or listen to music. So I was kind of completely becoming more, not able to participate in the activities I loved prior. Come December, I was only sleeping about 2 or 3 hours per night. I had a lot of issues with things like Raynaud's syndrome, where your fingers and toes will turn white. I started what now I kind of know of as PEM, so post-exertional malaise. I was only working about 2 hours per day sporadically, and that was 100% from home. In January, the burning continued. I was referred to the pain clinic at this point, and I started waking up with like a jolt in the night as if I couldn't breathe. I lost 60% of my hair, as you can see from the picture above, and I still couldn't listen to music even at this point, forgetting words, forgetting time, forgetting what I was doing. So really severe brain fog. Come March, I had my first injection for occipital neuralgia, which is where the nerves on the back of your head are sort of inflamed or impinged. And this is really painful, obviously. And so I got my first injections, and that was a positive test. Also can help block the pain for a couple months. A few weeks later, I dropped to the floor from pain while I was in a grocery store getting food, and it was the worst pain I'd ever felt, and I was really not sure like what was happening. That started happening every day, even in the middle of the night. So I had my second round of blocks in April. I was treated for trigger points, which is in your neck and your traps of your shoulders. And I was diagnosed with trigeminal neuralgia, which is known as one of the most painful diseases known to man. The cause at this point, they didn't really know, but we suspected that it might be long COVID because there were some other, reports coming out from Ann Oaklander's lab and others regarding post-viral issues with the nervous system. I again suspected PEM. This was from my own research, reading what the ME community had done before, educating myself on them, and I started pacing on my own at that point. I started getting referred by my doctors to occupational therapy for neck pain and deconditioning. So they were telling me a lot of this was because of deconditioning. So in June, a month later, since I wasn't responding to most of the pain interventions, I was told that I probably had a functional neurological disorder and that my body wasn't responding to this correctly. So I was referred to a 10-week mind-body intensive chronic pain program where I did learn some good skills such as breathing exercises. But, come July, this program finished, and I really didn't feel like it fit my needs. I didn't feel like it was deconditioning. I was really, knew something was wrong with my body, and I really had to push for attention in that way. So I joined the long COVID clinic because I'd be pushing through to work out because I was still advised. We didn't really know then, and I was just getting worse and worse. So I was basically completely bedridden at that point. Come August, I was referred for choking, dry mouth, and heartburn. I really couldn't eat solid food, diagnosed with GERD or chronic heartburn. And that sent me to the rheumatologist. So now this is September 22. And I was evaluated for likely Sjogren's syndrome, which is an autoimmune disease, and small fiber neuropathy with suspected dysautonomia, which would explain my heart rate and those types of things for those of you who are familiar. I was then referred to ophthalmology who did a tear test. They test how much tear production you have. I was making 0 tears at that point, so I was diagnosed based on my blood work and my symptoms as having Sjogren's syndrome. I started the process for ADA accommodations for work, which I will talk about. For those of you who are not in the United States, that's basically accommodations for the Americans with Disabilities Act, which protects you as a disabled American so that you can work. So, kind of what was next was that I had hearing tests because I was still having tinnitus 24/7. I had a tilt test for evaluating POTS, and I was positive. I fainted on the table. We then started lifestyle changes like water increase, compression gear, and started medication for the POTS. I also sort of had uncontrolled weight loss. I lost about 25 pounds in a 3-month period due to GI symptoms. And then in December, we moved to my first stellate ganglia blocks for pain, which did help the pain for about a month at a time. But my insurance wouldn't cover them after the 3rd due to the long COVID. I then had an endoscopy where they stretched my throat for a stricture caused by the heartburn. And I started getting eye drops and saliva medication for the Sjogren's to help with that. I also then started cognitive rehab in March of 2023, which was one of the best things that happened during that time, where I worked with my rehab specialist, Nate, who evaluated me, and I was diagnosed with executive dysfunction, pretty severe, which was, impacting my ability to do things like organize lists and pay attention to time, so the brain fog. And we started weekly and biweekly rehab at that time. I added a time release POTS medication, which did help a bit with my GI symptoms. In May, I had my husband drive me 7 hours to the Johns Hopkins POTS clinic because it was a year for me to be able to get in to see the doctor in Boston, where she verified that I did have POTS, validated my blood tests, and basically got me started on midodrine, which is another medication. I tested positive for a variety of antineuronal and markers that correlate with small fiber neuropathy, such as fibroblast growth factor 3, voltage gated potassium channel complex, Sjogren's syndrome B, etc. Because of that and my symptoms, I was diagnosed with post-acute infections, autoimmune small fiber polyneuropathy. So this is called SFPN. And basically what that is it's a small fiber neuropathy that where your body is being attacked by your nervous system. And the neurologist fought for immunoglobulin therapy for me at that time. I also started a modified CHOP program. In August, I started IVIG after being declined, and I had new onset incontinence issues at that time. So I started IVIG in September. That kept going on. I'm still on IVIG, which I'll talk about. Also in September, I was evaluated for mast cell activation syndrome, which is also a post-viral disease. And I was having all these allergic reactions, and I also was considered having that. So come 2023, I'm finally sort of starting to get a little bit of treatment. I did get diagnosed with neurogenic bladder. Botox was approved for chronic intractable migraine, which finally got me out of chronic intractable migraine, meaning I was having migraine every day. Now I have 1 to 2 per week. I have IVIG every 28 days at home now, nerve blocks every 12 weeks, Botox every 12 weeks. And just as a trigger warning, for those of you who are sensitive to this, I did start seeing a psychiatrist who is embedded in our chronic pain institute because I was having intrusive thoughts ongoing for the last few years, and I really finally needed to ask for help. So really in 2024, I had this long process of getting diagnosed. There was a lot of gaslighting at the beginning, which, made me get worse, I think, because I was still working out and doing things like that. And I didn't really see improvements until all 3 disorders, the Sjogren's, small fiber polyneuropathy, MCAS, and also the...
About 2 minutes left.
Okay, thank you. We're getting treated. I have a huge multidisciplinary care team, right? So I have 18 doctors. And who coordinates that? It's me. So how do you do that with work? So basically, I talked to my rheumatologist, got accommodations where basically I was approved, and I'll tell you what I do. So I have my feet up in my office. So I bought a chaise lounge to put my feet up. I got a HEPA or air filtration in my classroom. I work from home during flares and IVIG. I take it 1 day at a time. I do cognitive rehab. I gave up all the ghost work, which means, the extra free labor that you do, including social events or mentorship that's not for your students. I manage by Slack as much as I can and Zoom. I also retired projects I wasn't interested in. I'm a huge proponent for collaboration and teaming, so I work with other faculty to move the research forward. And I also focus on completing items in order of importance. So I think pacing is key for me. Not everyone is being approved for these protections, and I think as a community, we and our allies need to support them. Also, this is especially for women and minoritized folks who are most impacted by long COVID. So how can managers help? I think they can, follow this paper. You can check it out. It just came out looking at a manager's guide for long COVID at work. So one of the things that's really helped me is as a patient, research gives me agency. So I have volunteered myself for 5 clinical trials and also started applying for funding in autoimmunity. And so this sort of makes me feel like I'm helping the community. It gives me a real passion to continue to do research, to get answers for these diseases, which is why I'm so excited about this conference. And one of the clinical trials I did was this work with Michael Van Elzeker and others that looked at the neuroinflammation post-COVID, where they found that all 12 of us who were long COVID patients had brain inflammation and vascular inflammation.
We're going to have to go into the Q&A now.
Sure. So basically where I am now is I'm starting to heal a bit better, and I will post these slides. So sorry, I went a little bit long, but thank you so much for your time. IVIG is really helping me, and the disability accommodations as well. So thank you for your time, and I'm very happy to take any questions. Thank you.
So yeah, we've got about 5-minute Q&A right now, so I'll go through them. So what are your recommendations for patients who are severely limited ability to work less than 10 hours a week, and how to get involved in academia, research in general, or even pursue a PhD in a field in which they are already on hold?
Sure. That's a great question. I think
already hold a degree, sorry.
Oh, sure. I think that's a great question. I think if you can work 10 hours a week, that's fantastic. This, disease is so severe and it changes over time. So I would say the first thing to do, take care of yourself, do your pacing. And if you do have, 10 hours a week to work, there's all sorts of things you can do to get involved in research. Basically, there's, the ability to actually help people with editing. If you can look at your computer, you can sign up for support groups that are, coming out with papers. Like we have the Patient-Led Research Collaborative, that writes papers together about, how to do things, how to change policy, research papers with scientists, and you actually help to write these papers. So that's something that people can sign up for. Also for me, and maybe for you, it's very difficult to get to clinical trials if you are severe, right? So, we've been really advocating for researchers to be able to go to the patient. Obviously with things like MRI, that's difficult. But if you do have the energy, it's really hard to recruit for clinical trials. So that was something that made me feel really good. And like I was helping people, even if I crashed a little bit after. But keep yourself safe, obviously. So thank you. That's a great question.
I think we might have time for one more. When applying for a job in academia after your PhD, postdoc or assistant professor with LC, is it a good idea to push through in the job market process and try and hide PEM long COVID, or should you be transparent upfront?
Well, I would say, that process is pretty grueling. So again, first take care of yourself. If you need to wait a year to be able to pace, I think that's the number one thing that helped me recover a little bit. I still have crashes, right? But I think I'm personally transparent about this. I think talking about it gets people to understand what's going on. When you're looking for a job, obviously you might have some bias. And that's something that, depending on what country you're from, there are laws against that should protect you from that. But I really think that's a personal question. If you feel comfortable saying, I need these, accommodations during your interview, I need a place to sit, I need breaks between meetings, feel free to speak up, right? If the place doesn't let you do that, it might not be somewhere that you want to work anyway.
Okay, awesome. I think that's about time. So thank you very much for your presentation, Dr. Koppes. And thanks for everyone who submitted a question and everything.